everyone. Welcome to the 12th episode of Dose of Derm, a dermatology guide for medical students. My name is Emma Holjak.
And my name is Iryna Savinova. And on today's episode, we will be interviewing Dr. Mark Kirchhof. Dr. Kirchhof is the division head of dermatology in the Faculty of Medicine at the University of Ottawa and the Ottawa Hospital.
Dr. Kirchhof completed his medical degree and PhD at Western University in London, Ontario. He then went on to complete his dermatology residency at the University of British Columbia in Victoria, BC. Without further ado, we are excited to introduce to you Dr. Kirchhof.
Thank you so much for joining us on our podcast today, Dr. Kirchhof. We are so excited to have you, and we really appreciate your time.
Oh, thank you for having me. I'm going to correct something already. I did my internship in Victoria, and then I did my residency in Vancouver. So I did both training in Victoria and Vancouver at UBC.
Wow. Okay, well, we'll definitely add that to the record.
There you go.
And we actually do have a question later on about all the places that you've lived, because it seems like you had a good diversity within your training, which is really interesting to us. But we'll kind of start at the beginning. And the first question we want to ask you is about your path within medical school in finding dermatology and deciding to pursue it, and kind of how your whole experience within the field and your training has been.
Well, okay, there's a lot of questions there.
It's giving you a big chance to tell us all.
So we'll start off with my path to dermatology. Generally, I am a late bloomer, I will say. And so I did an MD, PhD, as you heard earlier in my introduction. That started with 3 years of research, basic science and immunology, and then I started medical school. So I divided it in a 3-year research and then a 4-year medical school. I didn't want to interrupt my medical school training. So then third year rolls around, and I started clerkship. I still didn't really know what I wanted to do in medicine. I had a background in research and a background in immunology, but really I was open to all sorts of things. And so I initially started rotations in gen surge, and I became very interested in surgical procedures, and I talked to people about that. I was interested in urology at one point in time. But I quickly realized that I liked everything. And so it became very difficult for me to choose between different specialties. And so I was looking for something that would be, somewhat of a generalist, but also be able to have some sort of specialty designation and the ability to, parlay my research background into some sort of medical field. And so at that time, dermatology was, and still is, I would say, exploding in terms of research, and the impact and importance of immunology to the field of dermatology is tremendous. And so I picked dermatology probably in the middle of my 3rd year, which is a very difficult thing to do, but nonetheless, I said, okay, I'll try to focus on this. I also ranked a variety of other specialties as well. I ranked internal medicine and pathology. And so dermatology is one of the things that I ranked in my rank order list, and I was lucky enough to match. But really, I think I could have been happy in a variety of different things.
That's a really interesting path to dermatology. Something Iryna and I were actually talking a little bit about prior to is I think you are our first MD PhD that we've had on the podcast, which is really exciting. And I was kind of wondering, how did you decide going about to apply to like an MD PhD program? Was research something you were interested in your undergrad, and you kind of went from there?
Yeah, so we'll back it up even further. See, we're going in reverse order here. So when I was in high school, I did a lot of science fair projects, and I was involved in, scientific experimentation. I was always interested in science and the process of discovery. I read a lot of scientific books and scientific philosophy. I went into my undergrad at McMaster, and I did molecular biology, which is like a combination of biology, biochemistry, a little bit of physical chemistry in there too. So again, sort of a combination of different things together. That program no longer exists, but at the time I thought it was very good and very interesting. So I did molecular biology as my undergrad, and I did a thesis, and I did a lot of research projects because I really enjoyed that. When I entered I think it was 3rd year, I was working in a lab, and my supervisor at the time counseled me. And I think this is the one important thing that I can tell medical students, is to have good mentors along the way. So one of my mentors was Dr. Shellhorn, who is still a professor at McMaster. And he said, you know, research is great, but it's a bit of a struggle. And, you know, you will constantly be fighting for grants, you'll be constantly fighting for tenure, and research is a tough gig and getting worse. People often have to do multiple postdoctoral fellowships, and even then they're not guaranteed to get a position. So he realized this and counseled me and said, you know, if you do clinical research, you're going to be far further ahead. The funding rates for clinical research are far higher, and you can always fall back on your clinical background and your clinical degrees if you need to earn a living, because that is some consideration we have to think about. So I applied because of that to the MD PhD program. At the time, there weren't many MD PhD programs. There are now many of them across the country. But I applied to McGill, U of T, and Western. And I got interviews at U of T and Western. And I was accepted to both programs, but I decided to go to Western because they offered a sizable scholarship. And so economically, it was better for me. Also, the lab that I was able to start my research with there was very well respected. And so that's why I did an MD PhD. And then from that, I decided to do dermatology because my research background and the field of dermatology suited that pathway the best. So I think I sort of, each step in my life, I decide upon as it presents itself. I know there's some people who, you know, decide they want to be dermatologists when they're 6 years old. I was not one of those people. I decided and evaluated each step of my life as it came along.
You know, I think that's a much more kind of reassuring approach to things, knowing you can kind of take it as you go and you didn't have to have a 20-year plan starting at the age of 10. And
No,
immunology was a really interesting, I guess, way to go because it's really applicable to so many fields. And if you did end up doing internal medicine, super relevant to allergy and very broad.
exactly. That's the one advice I have for people. Try not to close doors too early on. Keep as many doors open as possible, because that will provide you with more opportunities. And even currently, I will say in my career, in my position, I would have many more doors that are opening on a regular basis than closing.
That's great to hear. And something you mentioned, I kind of wanted to follow up on. So we had an episode where we had a panel of residents and we got question submissions from our listeners. And something that was a really big topic was whether we have any, or not we, the residents, had any advice about finding mentors. And you touched on the fact that it was so important to you in your path to have good mentors. Now, as you're more on the mentor side than the mentee, do you have any advice to students who are trying to find a mentor on their path?
And yes, I do. Sometime, and most of the time, I will say it's an organic thing, and you can't really force mentorship. And it's sort of a connection that develops between two people, and you know, you have aligned points of view, or somebody takes an interest in your career. You know, you can absolutely ask people to be your mentor, and in our program, we do have a sort of assigned process where we do try to connect residents with staff as a mentor-mentee relationship, and I have mentored several people in our program. But usually that selection process in itself is somewhat organic. It's not forced. It's, you know, if you think there's somebody that you align with that can help you in your career, by all means. And then there's also, you know, people who may have a short mentorship role in your life compared to longer mentors. And so things can change in that way. I will say that each point in my life, I've always been very lucky to have people that I've aligned with and had good mentorship. They help guide you and help answer some questions. You know, there's a hidden curriculum not only to medical school but to life, and they often will help you make decisions that will impact your life greatly. So it's good to find somebody who is, I would say, level-headed, has similar values and thoughts that you have, and will be able to align with your career path well.
Well, thank you. We appreciate your insight on that.
No problem.
kind of had another question building off some of the things you said previously as well. And actually, this was a big topic of conversation in our resident panel as well. You mentioned that you, I believe you said you mentioned that you applied to a few different specialties. And I was wondering how you went about the process of deciding to like apply to different specialties and if that was a very overwhelming process or you found it manageable or not.
I mean, it was costly and it involved a lot of travel and interviews. And so that was the downside. And the other problem is interviews are not the least stressful thing you can do in life. And so I got better as I went along because I think I interviewed at 14 places or something. So, as you go along through the interview process, it becomes less stressful and you sort of are better at it. But generally speaking, my thought process for selecting the programs that I did, generally speaking, I realized that surgery was probably not compatible with my research and my background. And I also have a requirement for sleep. So I again realized that again very early on in my clerkship that I do not function well at 3 o'clock in the morning with no sleep. People often asked me if I was the patient and if I needed to be put into bed. So I thought to myself, okay, well, based on that, I will pick specialties that are compatible with that. So I applied to internal medicine, dermatology, and pathology. And I received interviews in all those, and I interviewed at many places. I also had the added wrinkle that I did couples match, so that was also interesting. And my partner at the time was luckily applying to family medicine, so it wasn't two hyper competitive specialties that we're trying to match together. But still, it was a consideration in terms of location and where we wanted to potentially live.
Wow, it seems like you've had all the little like experiences across the board with MD, PhD, couples matching, parallel planning, a lot of gems for us today.
Okay, well, yes, I think I have a very circuitous life path, is what I would describe it as.
We saw when we were preparing for this podcast episode that you are currently listed as the Vice President of the Canadian Dermatology Association. We were wondering if you could tell us a little bit about what this like role consists of.
Sure. So I've been involved with the CDA for a long period of time. For a long time, I was basically an observer. I acted, and I still act as the liaison between the Royal College Specialty Committee and the CDA board. And I've been a member of the CDA board. I think it's going on 8, 9 years right now. And during that time, I have sort of taken on different causes and been involved in various committees. So for a long period of time, I was a member of the Future of Dermatology Committee, and now I'm the head of the Stakeholder Membership Committee. So we are basically looking at a variety of aspects of dermatology, particularly focusing on what the future roles of dermatology and dermatologists are, and how to ensure that the specialty and the specialists continue to occupy and maintain an important role in the healthcare system. So with that background and that idea, I decided to run for a higher political office than I was at the time. And in the CDA, basically, you run for president, and then it's a 4-year schedule. So you run for president, and if you are successful, you become vice president the first year, then president-elect, then president, and then past president. And so I'm on that trajectory. And so another part of my personality is that I enjoy making things better and helping, generally speaking. I know that sounds very, contrite or universally obvious that we all like to help people and help things, but I certainly get a lot of personal satisfaction of improving systems and making better outcomes. And so right now, I think we at the CDA are at a crossroads in our specialty, which will involve a lot of effort, and I'm happy to be part of that process as much as I can.
That's super interesting to learn about. I guess until you're involved in these committees or boards, you never really think of how they function or their role. So it's interesting to see that you kind of progress through different roles before becoming president. And then I guess the last role is kind of mentoring the next president, is from what it sounds like.
Correct. Yeah, there you want to have some overlap, so there's continuity of leadership.
That makes sense and is very cool. And maybe this is something that you were referring to when you mentioned kind of that crossroads in the field, but we were actually wondering, and we would love to hear your perspectives. This is a little bit of a loaded question, maybe, on what you think the biggest issue facing the field of dermatology is right now.
I mean, I think the biggest issue facing dermatology, and I will say by proxy, the healthcare system in totality, especially in Canada right now, is the erosion of primary care. We are seeing tremendous pressures on the healthcare system as we see fewer and fewer Canadians have family physicians or primary care providers. There was just a special or news article or interview process on the CBC last night talking about the crisis in the emergency care rooms across the country. And they interviewed several ER physicians, and they all stated that the lack of primary care providers was a major problem in the healthcare system. And we see that as well in dermatology. I have now been asked several times to become the de facto primary care provider for some of my patients who no longer have a primary care provider. And what that does is basically is it uploads care onto emergency services, walk-in clinics, and specialty care. And just recently, we had 4,000 patients on our wait list here at the Ottawa Hospital.
Wow.
And wait times of a year or longer. I've heard of wait times of up to 2 to 3 years for dermatology. And so that wait time problem, which is compounded or partially secondary to that lack of primary care providers, I think is the biggest problem facing dermatology, because when you can no longer see patients in a timely fashion, the care that you can provide is diminished and eroded, and it puts pressures throughout the entire system. There's obviously other compounding factors that are involved. We have a changing and a altered workforce demographic. We see fewer people doing academic medicine. We see more people doing private medicine. We see more people doing cosmetic dermatology. But I would say those are all minor in comparison to that major component that we're seeing an erosion of primary care providers in the healthcare system.
Right, that's definitely a pertinent issue to think about and talk about, because family physicians are so important to managing kind of every other specialty, and they're really there for a lot of that preventative medicine. So I guess if a lot of the population isn't getting things caught early, then even the skin conditions that would be normally easy to treat or excise can grow to really significant amounts that become kind of more severe problems. So that's definitely an interesting thing to think about for sure, and appreciate your insight on that.
No problem.
The next topic we wanted to talk to you about was, we were wondering if there was a piece of advice or something maybe you think that all students should know or consider before pursuing dermatology.
I guess the most important thing that I would say to any medical student that's considering dermatology is, as I mentioned earlier, keep your options open. Often when students rotate through my clinic, I ask them, what are you backing up with? And I had some people who say, oh, I'm not backing up with anything. And I was like, well, you're probably going to be happy in other specialties and other things as well. And based on the numbers alone, not everyone who wants dermatology is going to get dermatology. And so I think it's important to always keep that in the back of your mind, that happiness is not dependent on getting exactly what you want in life. It's good to be open to other opportunities and other possibilities.
I think that actually offers a lot of students reassurance because sometimes parallel planning can be a really nerve-wracking topic, to some extent controversial, maybe in some specialties. So it's good to hear that it's actually a reasonable thing to do, to kind of explore other options in parallel to dermatology that may interest students as well. Um, Knowing that you are a dermatologist, we did want to get your insight on what you think, or what you would say your favorite and least favorite parts about dermatology are.
I I will answer this a bit because the problem is we answer it from our own point of view, and so I have a heavy administrative burden, being the head of dermatology, being the head of a division.
Sure.
I would say my biggest headache is bureaucratic or bureaucracies and politics. So bureaucracy plus politics, and that takes various forms. Um, Often, when you are trying to promote or get an initiative completed, uh, those things can stand in the way of completing those, and that's sometimes a bit frustrating. Um, you just have to sort of reach a moment of zen and understand that things will happen as they happen, and you can just do your best. But I would say for me, that's the most frustrating component of my career. The best things of dermatology, I would say there's probably too many to list. I'm very happy in my career choice, but just off the top of my head, I get a kick out of seeing patients and making them better. Generally speaking, dermatology is very lucky in that most of our patients do improve. So that is very satisfying. So we have patient satisfaction is high. Two, I would say the amount of new knowledge, new diagnoses, interesting cases constantly keeps your mind, I would say, occupied, or it keeps you, um, I would say, sharp, because you're constantly being challenged by new information. We are having an unprecedented level of development of new medications and new treatment options for our patients in dermatology. So you have to learn on a regular basis. So it's non-stop learning. I would say that's another thing that I quite enjoy. I probably learned more after residency than I have during residency by now. And then I would say I am very lucky to be surrounded by colleagues who I get along very well with, who all contribute to our division and are really amazing contributors to dermatology across the country, locally, provincially, nationally. And so I'm very fortunate to be surrounded by great colleagues and great residents. We have an amazing group of residents in Ottawa.
That's a great answer. And just coincidentally, there's so many more pluses than there were negatives.
Yes, there definitely are. There always should be. I think if your job and your life has more negatives than positives, then you probably should change something.
Fair enough.
And so I think you mentioned previously that you have students sometimes like with you in the clinic and things like that. So we were wondering if you have any advice for medical students who are currently or will be in the future completing dermatology electives, maybe things that they can do to stand out or contribute to the team.
I I will say that, working hard is an obvious thing. Being enthusiastic is an obvious thing. Um, I will also say be yourself is an important aspect. Uh, don't the don'ts are probably perhaps more pertinent, because those things I just said are kind of obvious. Um, the fallacies or the problems I've seen some med students fall into is if they're overly enthusiastic and overstep um, their other abilities, their competencies, the boundaries of being a medical student. I think there are situations where you can sometimes fall into some problem or get into some problems. But generally speaking, friendly, enthusiastic, genuine, hardworking. I think these are universal aspects that we all look for in our colleagues and residents and, our doctors.
Definitely. I think that's great advice and definitely advice that everyone should be able to strive to do. Just, yeah, be yourself and be a good member of the team. That all makes sense.
Yeah, I also think that it's universal to whatever specialty you pursue, even besides dermatology, it seems. Something that we also did want to expand on was not all medical students will be able to do a elective placement at Ottawa or the Ottawa Hospital. We were wondering if you could share a little bit about your team and the program and certain things that you find unique, or anything really about Ottawa's residency program that students may not otherwise know if they don't complete an elective.
Oh, you're asking me to try to market the residency program to potential medical students.
I mean, I think most students are sold on it, right? Anyways, but sure.
Okay. All right. So I will say the most important thing are the staff and how dedicated they are to the teaching of residents and to the success of our residents. Everything else is, logistics and background, but that's the most important thing. We have an excellent program director, Dr. Carly Kirshen, who is very dedicated to our residents and has done an amazing job. We have numerous staff members who work at the hospital and in the community who all volunteer their time and provide amazing clinical opportunities and learning opportunities. And then another thing that is very unique is our didactic learning is all generally coordinated with staff teaching. So you will hear from some other residents and residency programs, and even my experience at UBC is that a large portion, and perhaps even a majority in some cases, of your didactic education is coordinated by and for residents. And so Ottawa is unique in that we have our half days that are all, or the vast majority are, lectures and teaching that's provided by staff members to the residents. And that's just part of the dedication that we have to the training. But if you look at our website, and you'll see the other things that often people will cite, and if I read applications, people often cite the fact that we have a connection with Iqaluit, and we do visitation there. Next year, Dr. Kirshen and I will be going 1 week at a time. And so residents have the opportunity to experience medicine in a more remote and rural environment. That being said, we also have a locally remote or more rural clinical opportunities as well. I go to Carleton Place, which is about 45 minutes outside of the city. Dr. Bose, who's another dermatologist, does that as well. We have a dermatologist who goes to Almont, Chris Sibley, who works there. And we also have specialty clinics. We have a skin of color clinic that has received a lot of media attention that people have also cited as being rather unique. In the next while, we hope to start a hydradenitis suppurativa clinic, a immunosuppressed skin cancer clinic. We have a pigmented lesion clinic. We have phototherapy. We have one of the most renowned patch testers in the world who works in Ottawa. We have 2 Mohs surgeons now. And so a variety of cosmetic clinics that are affiliated with the training program. So I think generally speaking, we have a huge breadth of specialties. And then we have the pediatric component. We have a pediatric hospital where we have several dermatologists working there, all providing excellent care. There's a vascular anomalies clinic there. And so as you can see, there's a huge amount of opportunity, I would say, within our program. And then we also have an internal scholarship that funds external electives. So we provide funding for our residents to go elsewhere and to see other programs and other training opportunities, and actually bring those back. We just had a presentation from one of our residents who won the scholarship. It's called the Dr. Kathy Ruddy Scholarship, named in her honor. And she was able to come back and give an excellent presentation on the things that she learned from going to London, England. And so overall, I would say lots of opportunities, lots of support, and really a collegial environment. I didn't get into all the fun stuff that we do because I don't want to oversell the program.
That sounds wonderful. And I did see that, I think the Ottawa Dermatology Instagram did post about that presentation that one of your residents did from London, England. That's very cool to hear. Just wanted to clarify, so all the residents have the opportunity to rotate at these different sites if the staff are there? So you mentioned Almont, some of the rural areas.
Yes, absolutely. Yeah. I mean, it's all open to the residents. They can decide on what they want to do. Some things are core requirements, right? They're just like every residency program, you have to rotate through some core clinics,
Mhm.
and those are staffed at a higher level. And then other ones are more an elective or selective basis.
Okay, very cool.
So we had one final question for you of this segment before we head into our few rapid fire get to know you question segment. And the last question was, we wanted to see if you had any or a last piece of advice for our listeners, maybe some advice like pertaining to anyone who is pursuing this path right now.
Oh, well, that's a loaded question. I have many pieces of advice. Uh, the
Lay
first,
it on us.
yeah,
Go for
I know, I know. Well, this could be another podcast in itself.
Okay.
The first thing is trust in yourself. The second thing is probably don't fret or become too anxious about the process. Um, Enjoy it while you can. I know it's hard to say when you're actually going through it, but looking back, the different interviews that I did and the opportunities that I had by doing electives in different specialties in different places, those have really, impacted the clinical person and the administrative person I am today. So I think that's good. So have fun. Again, if life is giving you more negatives than positive, you're doing something wrong. Try to change that. And then, if you don't get dermatology again, don't be anxious about that. It's fine too. We've had several candidates who, came through our program who were excellent, who didn't match for whatever reason. And I think they are all in alternative careers now, I think doing well. And, again, you will find happiness in a lot of different things that you can do in life. So I think that's a piece of advice. If you want to get into the logistics of the application process, there's that whole thing, do research, get some papers, find a mentor, work with somebody, try to do electives in as many places as you can. Yeah, there you go.
Well, that's great. Thank you so much for that grounding piece of advice. I really like the do not worry mindset. So to end off the episode, we like to ask our guests some rapid fire questions, just so our viewers and listeners can get to know a little bit more about you outside of medicine. And our first classic question is something that we've asked all our guests. We may retire it soon, depending on how it goes, but the question is, what is your favorite or go-to skincare product?
Oh, I see. Um, so this is actually, I'm not going to get on a soapbox entirely, but I will somewhat. I will say, generally speaking, I'm a simplest dermatology who follows hardcore evidence. And because of that, I believe in very fundamental and simplistic skincare products, which is different than some of my colleagues. And one day I will gladly debate them on this, perhaps in a future podcast. So I will say the most important thing to me is sunscreen.
That's a fair answer. You heard it here first. Dr. Kirchhof recommends sunscreen. I don't think that's super controversial.
Exactly. It's got the great evidence. It's one of the best things you can do. If you look at aging, the vast majority is caused by sun damage and sun exposure. And so all those other products that cost hundreds, if not thousands of dollars are a waste of money if you're not using sunscreen. There you go.
Very practical. I like it.
And then our next question we had for you is, it seems like you are pretty well traveled, especially within Canada. It seems like you've been to a lot of different provinces and cities. So we were wondering if you had a favorite city that you've maybe like lived in or visited for a while.
I mean, my favorite city doesn't exist. It's a theoretical city, so I will construct it for you. So I was born in Montreal and I lived a large portion of my life in Montreal. And I still have, I will say, an affinity to that city and that culture and the vibrance of people there and how they live their lives. So I really enjoy that component. What I do not enjoy is the general climate and winters of Montreal. So if you can take Montreal and transplant it to where Vancouver is today, I think that would be my ideal city.
Fair enough. It's interesting that you don't like the climate of Montreal, considering you're located in Ottawa, which I wouldn't say is too much different, but we'll let that slide.
Yes, I mean that you're absolutely right, but that's why I say there's pluses and minuses to everything you do in life. So Ottawa, as I said, I'm surrounded by great colleagues. I don't particularly enjoy the icy winters that we get in this region. So the amount of ice right now on the ground is treacherous, and I'm sure the orthopedic surgeons are doing very well right now. But ideally, I would live someplace that had either a nicer winter or no winter.
That makes sense. I'm actually like in the go to McMaster, so I'm in the McMaster area, and I'd say our weather is pretty mild too. It's no Vancouver, but it's pretty mild, and I have a lot of confidence comparing it to Ottawa because that's where my parents live, and I change my boots to skates and my winter jacket every time I head over there. So I
Exactly.
know
So
for a fact it's
you
less
know
mild.
what I'm talking about then. Therefore, yeah. I've
I
also
do, and I believe it.
yeah. I've been as an undergrad McMaster and my MD PhD in London, so there is definitely a difference between Southern Ontario and Ottawa.
Yes. Okay, and our last question is whether you have kind of a go-to coffee order or pick-me-up beverage that you enjoy throughout the day.
I generally drink tea now, so just an orange Pico tea in a thermos. That's what I bring, and then I
In a
usually
thermos.
in a thermos, yeah, make sure it stays hot as long as possible. And then I generally bring cookies or snacks for our clinic, and so it's probably not good for my New Year's resolutions, but yes, we usually have a cookies or some sort of snack during the day to keep us going when things get a bit rough or we're more hungry than not.
So if your earlier answer didn't sell everybody on Ottawa, now we know that you also have cookies.
Yes, it's true. Yes, come for the cookies.
Come for the cookies. So that'll be the slogan of this episode. Okay. And on that note, that wraps up the end of the episode. We just wanted to say a huge thank you to Dr. Kirchhof for taking the time to speak with us and give our listeners a little bit of insight onto your path to dermatology and some advice they can incorporate on their own paths. To all our listeners, thank you so much for listening. We hope you enjoyed this episode today. If you want to keep up with our podcast or offer any feedback on our next episode, you can follow us on Instagram and Twitter at Skin Curriculum or visit our website at www.skincurriculum.com. Otherwise, we hope you enjoyed this episode of Dose of Derm, and we hope you all take care.